Good afternoon, good evening, good morning, depending on where you are watching me from. Today, I want to perform an important procedure in nursing known as wound dressing, surgical wound dressing. Wound dressing is a scientific way of using sterile materials and various lotions to clean, to cover, and to protect the wound. And it is a trolley procedure. This here with me is my trolley, and on the top shelf of the trolley, I have a tray with a cover containing two gallipots for solutions, then a kidney dish containing a dressing gauze, then I have my receiver containing two dissecting forceps, two dressing forceps, and my suture, then a scissors. Then I also have my tutu forceps with me. I have two sterile gloves. This is my hand sanitizer. I have a dressing towel and a dressing Macintosh. Then on the bottom shelf, I have my apron. This is my apron. I have a tray containing adhesive tape, my sterile bandage, then a pair of scissors. Then I have two receivers, one for soil swab and one for used instruments. Then I have lotions, various lotions here. This is my spirit, this is my Usol, this is my iodine, this is my hydrogen, and this is my normal saline. Then my apron as well. So I begin by introducing myself and getting consent from Mrs. Ben. Mrs. Ben, good afternoon. I am here to dress your wound. And having gotten Mrs. Ben's consent, privacy has been provided and hand hygiene has been performed. Then I've wheeled my trolley to the bedside. Then after that, wash my hands once again. There is an additional instrument. I have one soapy water by the side of the trolley. So I'll bring down the bed spread. Then place my dressing Macintosh under the patient's wound. Then my dressing towel under the patient wound to protect the linens. Then my solutions, I'll pour out my solution and also my Providone. I've also pour out my Providone. Then with my tutu forceps, I'll pick, with my tutu forceps, I pick a dissecting forceps and dressing forceps. Then with these two instruments, I'll gently remove the dressing. And having removed the gauze, I'll place the gauze In the receiver, on the bottom shelf, in the receiver for use for soiled swabs, then my faucets, I will also discard them in the receiver for used instruments. I perform hand hygiene once again. Then I don my gloves. Then I don my gloves. Then I fix the second dissecting process and the second dressing process. I'll use my dissecting process and then pick a sterile gauze and I'll put it around the dressing forceps that cleaned the surface of the wound. I've discarded into the receiver for used swab. Now I pick another one and also pad it and clean and discard into the receiver for used swab. And I ensure that I've cleaned the wound very well. The wound is neat now. My receiver for my dissecting process and dressing process will be discarded. I've discarded them into the receiver for use. I've placed them into the receiver for use instruments. So I'll cover the surface of the wound. This is my bandage. I'll use the bandage to cover the surface of the wound. This is a sterile procedure. Then I dust my gloves and discard into the receiver for soiled swabs. So I can use my bare hand to cut adhesive tape or my plaster. Then the wound has been covered. I remove my dressing towel, make the patient comfortable, thank the patient for giving me the chance to dress her wound. Then I'll take the instruments. I've washed my hands and dry. Then I've wheeled the trolley to the sluice room or for sterilization. Thank you, Mrs. Bell, for giving me the chance to treat your wound. Thank you.